This is the fourth part of the 1066 Dementia Research Group Neuroex, Neurological and Physical Examination, and this fourth part focuses on the assessment of physical function. In this part of the training video, we look first of all at the assessment of gait, and this involves the 5-metre walking test. We ask the participant to walk 5 metres, turn and return at a normal speed. We time how long it takes them to complete this activity, and we count the number of steps that they take. We look at their arm swing, which may be normal, reduced or absent. We look at their movements and judge whether they are generally slowed, that is bradykinesia, and we also look for unsteadiness in the gait, which may reflect the presence of ataxia. Next, we assess the strength of their hand grip using a dynamometer. We assess their dentition by asking them if they have dentures, if they're wearing those dentures, and after removing any dentures, we count the number of teeth that they have in their upper jaw and their lower jaw, and we ask them about any problems they may have with chewing. Then we assess the participant's lung function using a spirometer, and we're interested in 2 measures here, the forced expiratory volume in 1 second, or FEV1, which is the volume of air in litres that can be expelled in the first second of expiration. Then we look at the peak expiratory flow rate, which is the speed at which air can be expelled from their lungs, and that's measured in litres per minute. Next, we assess the participant's weight in kilograms, and finally we look at their ability to stand up from a chair with their arms folded and the number of times they can complete that exercise in 30 seconds. At the very end, the assessor makes an overall assessment of mobility, which may be bed-bound, chair-bound, house-bound, with limited mobility outside or with free and unrestricted mobility outside. And this is based on everything that you've seen during the assessment of physical functioning, but also during the course of the entire assessment which you've made in the participant's home. So we're now going to assess the participant's gait, and this is where you need to use your 5-metre long piece of string. Now 5 metres is quite a reasonable distance, and it may be that no room or hallway in the participant's home gives you 5 metres of space. If that's the case, you may need to go out into the corridor of the building or even outside in order to be able to make this assessment. Please do try and make sure that the ground that the participant is going to be walking on is as even and in particular free of obstructions as possible, because above all we want to make sure that this is safe and that we don't have any falls. If you're worried about the patient's balance or security as they're walking, it may be that you need to accompany them as they walk so that you're ready to catch them or support them if there are any problems. If you have any doubts or worries about the ability of the participant to perform this task, then you shouldn't carry it out and you should just code as missing data. So what we have here is our 5-metre piece of string laid out on the ground, and what we're going to do is we're going to ask the participant to walk at their normal speed to the end of the piece of string, turn around and come back again. And we're going to be recording how long it takes them to complete that task, how many paces they use, how many steps they take in order to do that, and we're also going to be looking at the steadiness of their gait and their arm swing and making codings there. When you're practiced, you'll find it very easy to collect those 4 or 5 bits of information, but you will need to practice a few times so that you're clear about how this is done. So let me demonstrate first of all how it is that we would want the participant to complete the task. So here I am, and at my normal speed I just start here, the stopwatch is started, off I go, and I just walk at my normal pace, and I get to the end, I turn round, and I walk back again. So all just at my completely normal speed. I'm not trying to do it particularly fast, I'm just doing it at the speed which is natural. Now, what we're going to be looking at here is, first of all, arm swing. And usually speaking, when people walk, they will swing their arms as they go. And this is obviously a normal arm swing. However, you may find that a participant does not really swing their arms, that they have a slow gait like this and their arms are not really swinging. You may find that one arm swings fairly normally, whereas the other one doesn't seem to swing. So you will code the arm swing as being normal or reduced or absent for each arm as they're walking. Then you're going to be looking at the steadiness of the gait. And patients who have problems with balance, technically speaking ataxia, may walk with a rather broad-based gait and show signs of unsteadiness, a sort of rolling gait as they go, and this would then be coded as being an ataxic gait.
Ataxia is a term used to describe the inability to perform coordinated movements, as well as difficulty maintaining certain positions. Ataxia can affect almost any region of the body: ocular motor control, limbs, hands, feet, gait, truncal stability. On gait testing, we see that she's very wide-based, with difficulty turning and maintaining an upright balance either while standing or walking. She cannot even maintain an upright posture when attempting to stand with her feet together, even with her eyes open.
And again, as far as the gait speed is concerned, what we're looking for here is a general slowness of all movements, and so the movements are coded as being normal speed, slow movements, or very slow movements. So somebody who showed signs of bradykinesia or slow movements might just generally be very slow indeed with their gait as they're moving along, and this is obviously very distinct from a normal speed gait along these lines. So let's now, looking at this task with the participant completing it, look at how it is that these codings will be made. We shall lay out our string again. There we are. So, Carolina, if I could ask you to come to the beginning of the tape. So the first thing that you're going to need to do is that you're going to just demonstrate the task. So I'd like you just to watch how I walk from the beginning of this string to the end and back again, and I'd like you to do the same. So this is what we want you to do, just at your normal speed, to walk here to the end of the string, to turn round again, and then walk back again. Okay? We don't want you to run, we just want you to go at your normal, comfortable speed. Now, we need to time this, and we need to count the number of paces, as well as observing the gait. So I'm going to be using my mobile phone, which has a stopwatch on it, in order to record the speed. So here we have the stopwatch on the mobile phone, and I'm going to say to the participant, when you're ready, please walk to the end of the string and back again as I showed you. So start the stopwatch as they begin. Thank you. So that took 10.2 seconds. So we round that down to the nearest second, which is 10 seconds. And there were 12 paces that Carolina took to complete that task. Now, if I can ask you just to do that once again, Carolina, so if you can again just complete the task. At the same time, you need, as you're counting, you need to be looking at the arm swing, at the speed and at the steadiness of the gait, so that you get a general impression and you're able to make those 3 additional codings. So remember that there are 5 codings that we make here all in all, the time taken to complete the task, the number of paces, so you need to be counting that as the participant goes, but while they're doing it, you also need to be looking at their gait from the point of view of the steadiness, the speed of the gait, and in particular also looking at the swinging of the arms on the left and right side. Now, if you don't feel that you've captured all of that, then yes, it is possible to ask the participant to walk again, and to look specifically at the speed, the steadiness and the arm swing. But obviously we don't want to put the participant to more trouble than they should, so ideally if we can capture all of this in the initial timed gait speed test, then that will be best. So we're now going to measure hand grip strength using the Camry dynamometer. And there are two things that you need to establish before you start using this for the test. The first is to make sure that the measuring is set correctly. So to switch the device on, you press the on button here, and you see that it flashes up age 25 in this case, and it has a symbol for a woman. Now, we're not going to change these characteristics because all this does is that it tells you whether the strength that is recorded is weak, normal or strong, and we're not interested in that. We're interested in the force that is applied in kilograms. So the next thing that one needs to do is to press the start button, which I'll do that again to press on, and I press the start button, which then makes it ready to do the testing. And what I want you to do here, you'll see it says 0.0, so that's set and ready to go. But you see the unit is set as lb, that is pounds. And we don't want pounds, we want to measure this in kilograms. So we press the on set button, and you can see when I do that, it's changed the pounds to kilograms. If I press it again, it goes back to pounds, lb, but make sure that it's set to measure in kilograms, kg. So now we're ready to start measurement, but the first thing that we need to do is we need to adapt the grip to the size of the participant's hand. And you can see here for my hand, this grip is set too low here. We really need to make sure that the grip is actually catching this part of the hand, the middle part of the fingers there. And so what we need to do is to use this gauge here to just shift the grip, and we can see that as I'm turning in this direction, the grip is moving in this way. And for most participants with an average size hand, it's going to be somewhere in the mid-range on this scale, the little arrow here. We can see here this is a more appropriate hand grip there for me. You can see that nestles in the between the thumb and the finger here, and I'm able to get a good grip on it there. So make sure that you've made that adjustment. Generally speaking, if you have the grip in the mid-range on this scale, for most average size handed people, this will work well. If it's a small hand, you need to move the grip in this direction. If it's an abnormally big hand, you may need to move the grip even more in this direction. So the way that we perform this test is that, first of all, we make sure that we're switched on, we press the start button, we make sure that the scale is measuring in kilograms, we then perform the test with the participants standing up with the hand hanging loosely by their side, and then what we do is we ask them to grip as hard as they can and squeeze and squeeze and squeeze, and we try and encourage them to put in the effort. Just for a few seconds like that should be sufficient, and then we see the rating, which on this occasion is 55.8 kilograms. Now what we're going to do is that we're going to measure the strength in the right hand, followed by the left hand, followed by the right hand, followed by the left hand, followed by the right hand, and then finally the left hand. So we will take 3 assessments with the right hand, and we will take 3 assessments with the left hand. Ideally, perform the test standing up, but if the participant is unable to stand up, then they may instead perform the task sitting down, and we'll show how that's done as well. Now, before performing this task with the participant, you need to check that they're able to perform it without any pain or discomfort or risk to themselves. So you need to ask the following questions. Have you had surgery on either of your hands in the last 3 months?
No.
Have you broken a bone in your hand or wrist recently?
No.
Do you have pain in your hands or wrists?
No.
is there any other reason that you know of why you cannot perform this task on your left hand
No.
or your right hand?
No.
So obviously if the participant has bad arthritis in the left hand or has had recent surgery on the left hand, you will then not perform the test on the left hand. You will only perform the test on the right hand. If both hands have problems, then you may not perform the test at all, or you may try to perform the test but with caution, and if the participant says it's really painful or they don't want to carry on, then obviously you don't carry on with the test. So we're now ready to demonstrate the correct approach for testing in the participant. So for this test, I will ask you to squeeze this hand grip as hard as you can. So what I would like you to do is to stand with your feet hip width apart and your toes pointing forward, just like this. Hold your hand so that it's not touching your body and squeeze the handle. You should take a breath in, then blow out while you squeeze. Try and squeeze as hard as you can until you can't squeeze any harder. So, like this. Okay, so that's what I'd like you to do. So you now need to set the machine and press the start button. Ensure that it's registered 0.0 kilograms so that we've got the weighing metric correct. Give the hand grip strength machine to the participant, and if you hold that, let it go down by your side, deep breath in, and then breathe out and squeeze, hard as you can. Well done, thank you. And then you read the measurement, and on this occasion it is 24.5 kilograms. Now, we've tested on the right arm. What we're now going to do is move across and test on the left arm. You need to press the start button in order to reset the machine, make sure that it's saying 0.0 kilograms. And we're going to now do the same thing with your left arm. So if you hold that, it's away from your body, deep breath in, and squeeze. Okay, thank you. And on that occasion, it is 25.5 kilograms. Now, you're going to want to now repeat this with the right arm again, then the left arm, and the right arm, and the left arm, so that you have 3 measures on each arm. Make sure that the participant has had at least a minute between a test on the right arm and then repeating the test on the right arm again, so that they can rest. Finally, what I'm going to show you is if the participant cannot stand, how nevertheless we can perform this test with them sitting down. So, Carolina, if I could ask you to sit down, and we will set the machine, and we're going to do this test in your left arm. If I can ask you just to let your left arm hang down by your side. If you take the machine, breathe in, and squeeze, hard as you can. Good. There we are. And we got a measure of 22.9 kilograms on that occasion. In this section, we're going to ask the participant about whether or not they wear dentures, and we're going to look at their teeth, and we're going to ask them about any difficulties that they may have with chewing. So, Carolina, can I ask you, do you have dentures?
No.
No. Can I just, if you open your mouth for me, I'll just check. So yes, you don't have dentures and you're not wearing any dentures at this stage. Thank you. So at this stage, if the participant was wearing dentures, then you would need to ask them kindly if they might remove their dentures so that you can look at the remaining teeth that they have in their mouth. In this case, obviously, Carolina has no dentures, so we don't need to do that. If you're going to ask the participant to remove their dentures, make sure that they have a clean cup or pot or something of that kind to put them in, because they will obviously need to replace them later. So, Carolina, if I may, I'd like to count the number of teeth that you have, and I wonder if you could open your mouth so that I can just do that. So thank you very much. So we first count the number of teeth on the lower jaw, and there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 teeth on the lower jaw. and so you'd enter that code for the number of teeth in the lower jaw, and we then count the number of teeth in the upper jaw, and there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 teeth in the upper jaw, and so you'd enter that number for the number of teeth in the upper jaw. And then finally we have one more question, which is, do you have any problems with chewing?
No.
And if the participant mentioned that they do have problems, ask them to describe the problems, and then you would code either as having some problems or many problems with chewing, depending upon the difficulties that they have. So we're now going to carry out spirometry, that is testing lung function. And for this purpose, we're going to be using the pt4 spirometer. And when we test lung function, we're going to be measuring two things. The first is the FEV1, or forced expiratory volume, in 1 second. That is, how much air can the participant blow out of their lungs in 1 second. And we're also going to be measuring the peak expiratory flow rate. That is the speed at which the participant, or the rate at which the participant is able to blow air out of their lungs. The FEV1, the amount of air that can be blown out in 1 second, is measured in litres, and the peak expiratory flow rate is measured in litres per minute. Now, the first thing that you need to be able to understand how to do is how to assemble the pico for use. And you'll need, when you go in to assess each participant, to make sure that you have your own mouthpiece, which you can reuse when you demonstrate how to use the pico to participants. But you'll have to have a fresh mouthpiece for each participant, which is disposed of after they've used it. And to assemble the pico, I'll show with my mouthpiece first of all, you first of all have an adapter, and you put the adapter over, first of all, the mouthpiece on the pico, like so, and you'll then find that your own mouthpiece fits over the adapter, like so, making a nice tight seal. There we are. So the pico is now assembled and ready for use. And I'll just now show you how to operate the pico. You'll see that there's just one button on the pico. And first of all, if you can actually just see here, what we have registered here is the readings the last time that the pico was carried out. So I'll press the button again, and you can see that it alternates here between 737 PEF, so that is the peak expiratory flow rate is 737 litres per minute, and the FEV, coming up just in a moment, is 3.99, the FEV1, that is 3.99 litres per minute. So those, not litres per minute, but litres. So those are the two readings that we want to obtain from the participant. Now, to operate the pico, you need to press this button, and when you do so, it beeps, and then you see that there's a 0 and a line that is flashing like that. And this means that the pico is now primed and ready to use. Now, in order for the participant to use this correctly, they need to make a good seal over the mouthpiece. And the way that this is done is that you hold the mouthpiece with your teeth, and then you close your lips around the mouthpiece. Like that, so that there's a nice seal. And you need to demonstrate that to the participant. You've just asked the participant if they wear dentures. If they do wear dentures, they should take their dentures out in order to perform this task, otherwise there may be a safety issue with the dentures. So now, showing how it is that you operate the pico, you need to make sure that when the participant is holding the pico, they're holding it horizontally, like this, and you need to make sure that their fingers are not occluding or masking the vent at the top, so their fingers need to be here. This is how they hold the pico. They'll need to bring the pico up close to their mouth. You press the operating button, and when the display shows that the pico is primed and ready to use, you then say to the participant, take a deep breath in and now blow out as hard as you can. So let's do this sort of demonstrating for myself. So we bring it up close to the mouth like this, we press the operating button, it beeps a second time, we're ready to go. There we are. And what you see here is that there is an exclamation mark, and the exclamation mark can be there because there's a problem with the test. Either the participant didn't blow out for at least 1.5 seconds, or alternatively there was a little bit of a cough when they blew out. And I think in my case it may have been that it detected a little bit of a cough. So if you have an exclamation mark like that, you need to repeat the test again. So let's do this once again. We're ready to go. There we are, so we've now got a good reading, and you see the reading, the peak expiratory flow is 710 litres per minute, the FEV1 is 3.81 litres blown out in 1 second. That was a satisfactory test, there is no exclamation mark there. So we're now going to demonstrate how you would actually do the spirometry testing with the participant. And one additional thing to mention here is that this test should be done, if possible, with the participant standing up. If they're not able to stand up unsupported, then of course you should do the test sitting down. But if they are able to do that, you should ask them to stand. So, Carolina, we're now going to test your breathing. I'm going to ask you to take a deep breath in and then to blow all of the air out through this device. I would like you to blow as hard and as long as you can. Imagine you're blowing out a candle on a cake. Make sure that you put your the mouthpiece in your mouth, hold it with your teeth, and make a good seal to your lips. So I'm now going to demonstrate how this is done. So that's a good seal with the lips, and I'll now show what I want you to do with blowing out through the device. Just like that. So blow out as hard and as fast as you can, as though you're blowing out the candles on a cake. Now, having demonstrated to the participant, obviously you did that with your mouthpiece, so the first thing that you need to do is change over the mouthpiece so that you're using a fresh mouthpiece for the participant. So, Carolina, I wonder if you could stand up for me, and then we'll ask you to perform the test. So, first of all, if you can just take the spirometer in your hand there, just bring it up close to your mouth, and I'll ask you at a certain point to breathe in and then to blow out as hard as you can. So we prime the spirometer. Okay, breathe in and blow out. Well done. So we got an exclamation mark on this test, which means that we need to try that one time again. So I'll just ask you, when you're ready, just to do that one more time. So if you can hold this in your hand, that's it. Bring it up to the mouth. Okay, breathe in. Hard as you can. Well done. Good. So, we got a good test on that occasion, and the forced expiratory volume in 1 second, FEV1, is 4.4 litres, very good, and the peak expiratory flow rate is 502 litres per minute. So we just need to have one satisfactory test, and then we write those results for the peak expiratory flow rate and the forced expiratory volume into the record. So we're now going to measure the participant's weight, and to use this we'll be using these weighing scales here. Now the first thing that you need to check with the weighing scale is that the measurement is set here at the back to kilograms. You can see that there's a choice of pounds, of kilograms in the middle, or stones and pounds on the right. But we want to make absolutely sure that we are measuring here in kilograms. The next thing that you need to note is that there's a button here which is to prime the scales ready for measurement. And when you're ready to go, before the participant stands on the scales, you need to press that button. So we will now demonstrate how this is to be done. And you'll notice here that the floor is carpeted. And what you should try and do, if at all possible, is to find a hard but even floor surface, like a stone floor, in order to carry out this measurement. If that's just absolutely not possible and the only surfaces are carpeted surfaces, then you'll need to use a carpeted surface. You should also ask the participant to remove any excess and heavy clothing. So for example, I would take off my jacket. We would ask Carolina to remove her boots or shoes if participants are wearing those. But beyond that, you shouldn't ask the participant to remove any of their clothing or undress in order to have their weight measured. So, Carolina, I'm now going to ask if I could measure your weight, and I wonder if you could just remove your shoes or boots for me before we do this. Okay, and if you wait just for a moment, I'll just start the scales for measurement. And we see as soon as having pressed the button, it says 0.0 kilograms. That will show you that it really is set to measure in kilograms. We're ready to go. So if I could ask you just to step up onto the scales, and you'll see that the weight oscillates around a little bit, and it gets to the point where it's measured and it flashes, and then you ask the participant to step away, and the weight is there recorded, and that is 57.5 kilograms. So we're just going to demonstrate this again in close-up. So the first thing that you do is you press the button in order to prime the scale. You wait until it says 0.0 kilograms. You ask the participant to stand up on the scale, and we see the weight oscillating around, and then it flashes, and then the participant can step away, and the weight is recorded as 57.5 kilograms. So next we're going to carry out the chair stand task. And for the chair stand task, we're going to see how many times in 30 seconds the participant is able to rise to a standing position from their chair with their arms folded across their chest. So this is the task that we're going to be asking the participant to carry out, and we're going to time this and see how often they can do that in 30 seconds. Now, of course, the participant may not be able to actually stand up from the chair with their arms folded across their chest. If that's the case, then you are allowed to ask the participant to do this pushing themselves up from the chair using their hands and without their arms folded across their chest. So the first thing that you need to check is whether they're able to perform the task at all. When they've learned how to do it, then we ask them to repeat it and we time this activity. So let's see how this would work. So we would say to the participant, I'd now like to check your ability to stand up from your chair, and I'm going to show you first of all what I would like you to try to do. So first of all, I'd ask you to fold your arms across your chest and then to stand up like this. So could you try and do that for me, please? And be careful as the participant does this. So that was performed perfectly well there. Just to make sure that everything is safe, that there is no risk of them falling. So I've shown you what I'd like you to do, and I'd now like you to repeat this as many times as you can in 30 seconds. And I'll time you, and I'll tell you when the time is up. If you feel tired and you can't carry on, then please stop and that will be fine. So as many times as you can in 30 seconds. So, when we're ready, and when I say go, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 stop. Well done. So it's the number of completed stands, and so 13 stands were completed in 30 seconds, which is very good. Was that tiring?
A little bit.
A little. So do be very careful. Make sure that this is within the participants' capabilities. If they can't stand from the chair, even pushing themselves off, then you would make a code of 0. They were able to carry out no chair stands in 30 seconds. If they're able to perform it with their arms across their chest, then you see how many times they can do that in 30 seconds. If they're able to do it only pushing off, then you see how many times they can do that in 30 seconds. And you'll see that you make a record here of whether they cannot carry out the task at all, if they can carry out the task but they need to use their hands, or they can carry out the task as intended without using their hands at all. And then you record the number of repetitions of the activity that they've been able to complete in 30 seconds. So if you code for the first coding, 1 cannot carry out the task, then the coding for the number of repetitions is automatically 0. So next we will make a coding of the participants' overall mobility. And this is not something that you necessarily need to ask the participant, but will be based upon your observations in general from the physical examination and from all of the other parts of the interview that you've been carrying out with the participant and also with the informant, the participant's family member. And you have a choice as to whether the participant is considered bed-bound, chair-bound, that is that they can transfer from their bed to their chair, but very limited mobility beyond that. Housebound, which means they can move around within the house, but not outside of the house. Limited mobility outside of the home, so they can go outside, but not very far. Or completely free mobility inside and outside of the home. And so here you code the highest number that applies to the participant. If they're bed-bound, then obviously none of the other conditions can apply. So it's the highest coding, the freest mobility which they have.